everyone, so let's move towards our today's topic, which is
that is scalp. What is scalp? Scalp is is basically the skin which is present on the head, or in other words, the skin of the head is called a scalp. In easy medical book, you can easily see that the definition is like the skin which is present from forehead to the superior nuchal lines is called as scalp. Okay, so basically इजी मेडिकल बुक में जो मैंने लिखी है डेफिनेशन वो थोड़ी सी बाउंड्रीज़ के साथ है. नाउ फर्दर क्या बाउंड्रीज होती है वो भी आपको याद रखना है कि फोरहेड में कहाँ से ये स्कैल्प कहलाती है स्किन, और कहाँ से कहाँ तक होती है बेसिकली वो स्किन. सो द स्किन ऑफ हेड की बात कर रहा हूँ मैं, ठीक है. अच्छा, अब फोरहेड में जो रीजन है दैट इज़ सुप्रा ऑर्बिटल मार्जिन, फ्रॉम देयर टू पोस्टीरियरली सुपीरियर न्यूट्रल लाइंस, लाइक जब नॉर्मा फ्रंटालिस और नॉर्मा ऑक्सीपिटालिस पढ़ाया था और उसका लेक्चर आपने जब सुना होगा तो आपको पता होगा कि भाई सुपीरियर न्यूट्रल लाइंस कहाँ होती हैं, सुप्रा ऑर्बिटल मार्जिन कहाँ होते हैं. तो बेसिकली वहाँ सुप्रा ऑर्बिटल मार्जिन से सुपीरियर न्यूट्रल लाइंस तक, और जो लेटरली अगर हम बात करें तो जो टेम्पोरल लाइन है, सुपीरियर टेम्पोरल लाइन, इन्फीरियर टेम्पोरल लाइन, तो वहाँ तक ये अटैच होती हैं. तो ये पूरा का पूरा एरिया जहाँ पे ज़्यादातर एरिया बालों से कवर होता है, जहाँ पे आपके बाल उग रहे होते हैं, वो एरिया बेसिकली स्कैल्प का कहलाता है. नाउ व्हाट आर द लेयर्स ऑफ द स्कैल्प? बेसिकली स्किन होती है, कनेक्टिव टिश्यू, देयर आर 5 layers. ओके, सो हाउ टू रिमेंबर द लेयर्स ऑफ द स्कैल्प? इट्स वेरी सिंपल. The spelling of scalp is SCALP. Now you have to remember the spelling of the scalp. Scalp के S से skin आ रहा है, S के scalp के C से connective tissue. Okay, I am telling you the name of the layers. Okay, स्कैल्प के ए से एपोन्यूरोसिस, स्कैल्प के एल से लूज एरियुलर टिश्यूज, एंड स्कैल्प के पी से पेरिक्रेनियम. ओके, सो दीज आर द 5 layers which are the layers of the scalp. Now first layer which I have told you, that is skin. Skin is thick, and in this layer hair follicles are present because hair are growing from here, from this layer. Also this layer consists of sweat glands and sebaceous glands as well, and obviously it consists of rich blood supply. Now connective tissue layer, the another layer is connective tissue layer, which is also known as superficial fascia. Okay, superficial fascia. Now connective tissue layer है, fibrous and dense layer है. Okay, and it is present between the skin and the next layer, which is called as aponeurosis. So basically it is connecting the skin with the aponeurosis. Okay, now what is aponeurosis? Aponeurosis is the third layer of the scalp, and aponeurosis means the tendon. Okay, it is formed by the tendon and it is very strong. Okay, जो flat muscles होते हैं, उनके जो tendons होते हैं, उनसे मिलकर ये aponeurosis बनता है. And basically it provides the site, it provides the surface for the attachment of the muscles of the forehead as well. Now the fourth layer, that is loose areolar tissues. It is basically the connective tissue layer. It is basically the spongy layer, and you can say that it is a space. It is not a layer, it is a space. And in this space, if any fluid is present, that means it is a sign of the infection or inflammation. So अगर infection या inflammation होगी तो यहाँ पे कोई fluid मौजूद होगा. Otherwise अगर space है तो it is normal, and that space is called as loose areolar tissues. Now the last layer is called as pericranium. Pericranium को आपको periosteum से याद रखना है. What is periosteum? As you know that periosteum is the outer layer of the bones. So pericranium is the layer of connective tissue which is attached with the surface of the bone, and you know that outermost layer of the surface is outermost layer of the bone is periosteum. So you can remember pericranium with the word periosteum. Now what are the arteries? Which arteries are supplying the scalp? So it is very easy. If you understand the topic of arterial supply of the scalp, you can easily understand the venous supply as well. So first, what is arterial supply? First of all, from the anterior part or from the front side, there are total three arteries which are supplying the scalp. Number 1, supraorbital artery. Number 2, supratrochlear artery. And internal carotid artery. Supraorbital artery, supratrochlear artery, these two arteries are supplying from the front, and the another artery is superficial temporal artery. It is also supplying from the front. But first you have to remember that there are two arteries, that is supraorbital artery and supratrochlear artery, which is the branch of internal carotid artery. ठीक है, ये इंटरनल कैरोटिड आर्टरी की ब्रांच है जो एंटीरियर साइड से आपके स्कैल्प को सप्लाई करती है. The another artery, that is superficial temporal artery, is supplying from the anterior side, but it is the branch of external carotid artery. Okay, and it is supplying to the scalp. Now from the posterior side, there are two arteries named as posterior auricular artery and occipital artery. नाम याद रखना बहुत आसान है. सुप्राऑर्बिटल, ऑब्वियसली सुप्राऑर्बिटल मार्जिन एंटीरियर साइड पे होता है. ठीक है. सुप्राट्रोक्लियर आर्टरी, ये भी आपको याद रह जाएगा. सुपरफिशियल टेम्पोरल आर्टरी, ये भी आपको याद रह जाएगा कि ये तीनों एंटीरियर साइड से सप्लाई कर रही है. पोस्टीरियर, एज द नेम इंडिकेट, पोस्टीरियर साइड से सप्लाई करेंगे. और ऑक्सीपिटल आर्टरी, you know that occipital bone is present on the posterior side, so you can remember this as well. Now occipital artery and posterior auricular artery is supplying from the back side to the scalp, and they are the branch of external carotid artery. Now there are total I am repeating again, there are total 5 arteries which are supplying to the scalp. Number 1, supraorbital artery, supratrochlear artery, posterior auricular artery, occipital artery and superficial temporal artery. Okay, that's it. Now venous supply of the scalp. The names are similar, but the function and the process is something different, so I will tell you, no worries. Now supratrochlear artery and supraorbital artery is present on the anterior side, so they will unite in the angle at the angle of the eye. What is the angle of the eye? It is present between it is present like जहाँ आपकी नाक है ना, नाक और आपकी जो आँखें हैं जहाँ मिल रहे, the meeting point of your eyes and the nose is called as angle of the eye. So here the supratrochlear and the supraorbital vein will unite. Supratrochlear and supraorbital vein will unite and they will form facial vein. Then another vein, that is superficial temporal vein. It will join with the maxillary vein and they will form retromandibular vein. That retromandibular vein has two division, anterior division and posterior division. Anterior division will join with the facial vein and posterior division will join with the posterior auricular vein. Okay, so supratrochlear vein है, supraorbital vein है, facial vein है, retromandibular vein है, maxillary vein है, superficial temporal vein है, posterior auricular vein है. Okay, so it's very simple. आपने सिर्फ ये याद रखना है कि supratrochlear और supraorbital ज्वाइन हुई, facial vein बना ली, that's it. फिर मैक्सिलरी वेन और सुपरफिशियल टेम्पोरल वेन ज्वाइन हुई, रेट्रोमैंडिबुलर वेन बना ली, उसके दो डिवीजन है, एंटीरियर और पोस्टीरियर. एंटीरियर डिवीजन फेशियल वेन के साथ ज्वाइन हो गई और पोस्टीरियर डिवीजन पोस्टीरियर ऑरिकुलर वेन के साथ ज्वाइन हो गई. It is very simple. Now the last topic is nerve supply of scalp. There are total 10 nerves which are supplying to the scalp. Out of these, 5 are supplying from the front and 5 are supplying from the backward. Out of these 5 nerves, 4 are sensory nerves. That means 4 sensory nerves are supplying from the front and 4 sensory nerves are supplying from the back. And the remaining 2 nerves, that is motor nerve, one is supplying from the front and one is supplying from the back side to the scalp. Okay, the name of these nerves are not much important right now, but in future it will be important. Right now you have to remember like this कि भाई 10 nerves हैं, 5 आगे से supply कर रही हैं scalp को और 5 पीछे से. This was the whole topic you have to remember. Till then, work hard, study hard and good luck. Bye. Thank you.